Your eyesight may be saved in 20 minutes. A new procedure is being made available to glaucoma patients in Jacksonville. It's minimally invasive, and it's designed to save patients' eyes from further damage. Dr. Rajesh Shetty is an ophthalmologist at the Mayo Clinic performing the procedure. Nice to see you this morning. What is glaucoma, first of all? Well,
glaucoma is an irreversible disease that's caused by an elevation of the eye pressure. It causes optic nerve damage, and usually patients are asymptomatic till they've lost vision. The eye pressure is elevated because the clear fluid in the eye is not draining properly.
Got it. Okay, so there's a new procedure, about 2 years, you say, that it's been around. It's called the trabectome procedure. How does it work?
Well, what we do traditionally has been to use eye medications to reduce the pressure inside the eye. In the past, we've also used laser to try to bring the pressure down. We typically laser the natural drainage system inside the eye. This new procedure uses a small probe to remove the inner layer of that drainage system so that the fluid leaves the eye, exits the eye more easily.
We've got some video of how this procedure is done, minimally invasive, so that's good news for a lot of people.
Oh, it's great.
Yeah, and but probably pretty frightening, though, to think that they're going to have to undergo some type of surgery.
Well, the alternative is, of course, vision loss, and the previous surgeries, the conventional surgery that we have, is a procedure that involves a lot more sutures, involves a lot more time for recovery, and also generally, patients take several weeks before the vision recovers. This procedure, generally people will rehabilitate within the first week or two.
So if it's been in existence for about 2 years, chances are, I mean, could they improve upon this technique? Could something ultimately lead to a cure for glaucoma?
Well, hopefully the ultimate cure for glaucoma will involve regenerating the optic nerve or bringing back the natural neural tissues in the eye. But to this point, we don't have anything on the horizon that's going to do that.
I'm sorry, who's prone to glaucoma?
Well, glaucoma, we usually look for people that anyone over age 60 should get a baseline exam. African Americans are at higher risk, Hispanic Americans are at higher risk, and anyone that has a family history of glaucoma, especially with vision loss, should get a routine eye exams.
Any way to prevent it?
Well, the main thing is to get the baseline eye exam and then start the therapy to try to reduce the eye pressure. That's the only proven therapy to reduce glaucomatous visual field loss.
How long, if you catch it in time, how long can you prevent ultimate blindness?
Well, generally, in most patients, if you can bring the pressure down to substantially, the disease will stop. You can stop the disease from worsening.
All right, so this procedure is now currently being done at Mayo Clinic here in Jacksonville. One of how many places?
There's actually only 2 centers in Florida right now. We're the first center to perform it in Florida. Across the country, maybe about 12 to 24 centers are performing a lot of these procedures.
If you have more questions, call your local Mayo Clinic here. Dr. Rajesh Shetty, thank you so much for joining us this morning.
Appreciate it.